Okay, let's start. Let's have our drugs for bone disorders. This is chapter 29, I think, sa Katzung, but 35 ata ito sa Lipincon. Hindi kasi sila magkapareho ng chapter. Okay? So, for these lessons, we will be, enumerating first the process of bone remodeling, and then we will talk about osteoporosis, the Paget's disease, and the osteomalacia. And then we will also, syempre, since this is pharmacology, we will determine the non-drug strategies and also pharmacological therapy for osteoporosis. Again, I have already uploaded this slide sa Schoology. Kindly check. Para you have a copy of the slide. Let me check this also if mag-appear ba siya. Yeah, meron. Meron. Wait lang ha. Wait lang. Ito ba na? Wait lang. Okay, anyway. Nagalibog ko sa... Okay. Sige, let's talk about bone remodeling. So when you say bone remodeling, this is our process of synthesizing the bones, but at the same time, included there yung pag-destroy sa bones. Kasi ano yan siya process yan siya. Gagawa tayo ng bones, sisirain siya, gagawa na naman, sisirain na naman, until the bone structure will mature and ma-maintain yung normal levels of calcium in the body. Okay, so that is again called bone remodeling. In fact, 10% of our skeleton, tayo adults, is replaced every year. That is the process, bone remodeling. We have our bones, sisirain siya, i-destroy siya, and then we will produce new bones in the body. Okay? Now, the osteoclast class, that is these are the cells na responsible in breaking down our bones. So remember, in the remodeling process, destruction is included before you can synthesize new bones or skeletons in the body. Again, the one responsible for breaking down our bones are called the osteoclast. The process is called bone resorption. So if you hear the term bone resorption, it means our bones are being destroyed inside by the osteoclast. And the process is included in the bone remodeling. However, the one naman that are responsible in building new bones, since we are going to synthesize new ones, are the osteoblasts. Okay, again, this type of cells synthesize new bones. The process is called ossification or osteogenesis. Let me repeat that one. For the breakdown of bones, we have the osteoclast. The process is bone resorption. And then for making new bones, we have the osteoblasts. The process of making new ones is called ossification or osteogenesis. Okay? I hope wala yung malibog, Ana. Now, for us to make new bones, syempre we need minerals. Okay? For the structure and at the same time the strength of the bone. Now, the process is called bone mineralization, meaning we need to deposit minerals, especially the calcium, para mabuo yung bones natin and then maging strong siya, hindi siya basta-bastang nababali or napuputol. Okay? So again, what do we need for our bone mineralization? We need calcium. Actually, to be exact, that is calcium phosphate. And we call that common name for our calcium phosphate, which is found in our bones, and not actually with our bones only, but also our teeth. We have the hydroxyapatite. Okay, yan yung nade-deposit in the new bone matrix. Okay, in the process of osteogenesis or ossification. Okay. Now, if we have problem with our bone resorption and ossification, meaning mas marami yung nagbe-breakdown kaysa sa mga na-form na new bones, doon tayo magkakaroon ng disorder or disease. Okay? So, just like in the case of osteoporosis, anong problema dito? There is a progressive loss of bone mass and there will be skeletal fragility. So if we're going to look at the bones of a healthy person and compare it with someone with osteoporosis, ganito yung magiging mukha. Okay, so as you can see, there is the bone here, the healthy bone class, yung density ng minerals class na nakadeposit in the bone itself. Ano yan siya? Siksik yan siya dyan. And that makes the bone strong. Wait lang ka, your internet connection is unstable. Basig mag-choppy ko. Let me know if choppy ko ha. Again, for healthy bones, since complete ang mineralization, we have complete hydroxyapatite here. We have the calcium phosphate here. Ayan, buo yung loob ng bones. And this one is a strong one. Now, to compare that one to someone with osteoporosis, there is loss of bones inside. Though outside class, in the structure outside, we can see na okay pa naman yung bones nila outside, no, buo pa naman. Pero when we look at the inside, doon natin makikita na may loss of bones na pala, the density, especially the minerals inside, nawawala na siya pala. And because of that, nakulang na yung minerals na deposited in the bones, nagiging fragile na yung bones natin. Madali na itong mabali. As you can see, diba, wala na kasi siyang laman. Okay? So yan yung problem natin with osteoporosis. And what will happen to a person with osteoporosis? There will be deterioration of the vertebral support. Kaya kung makakita tayo ng someone with osteoporosis, nagabako na sila. Okay? Their bones are fragile, so wala na din siyang lakas. Kaya yung pinakamalaking bones natin sa body, this one, the vertebral column, talagang liliko yan siya. Wala na siyang support, wala na siyang lakas, wala na siyang strength. Okay? Now, we are talking about the bone mass kasi yun yung nawawala when it comes to osteoporosis, yung laman niya. This is also known as the bone density. So anong ibig sabihin yan? The bone mass is actually determined by the amount of bone na present doon sa skeletal structure mismo. So kagaya nito, this is the whole skeletal structure. The bone is still intact and you have the bone density inside. Marami talagang bones dyan. Okay, sa skeletal structure. Talagang buo siya, maraming minerals. Dito kasi class sa bone mass ng person with osteoporosis, wala na siyang laman. Okay, so nawawala yung, the bone being deposited there in the skeletal structure is actually lessening. Mas marami na yung nasisira kesa sa nabubuo. So mas mabilis yung process of bone resorption kesa sa process of making a new one. Diba? We call that ossification or osteogenesis. Now, in fact, at age 35, tayo lahat ha, pag tumuntong tayo ng 35 years old and above, babae ka man or lalaki, we lose at least 0.3 to 0.5% per year. And that is a part of our aging process. Mas marami na yung nasisira na bones kesa sa bagong bones na nabubuo. Okay? Pag tumuntong tayo ng again, 35 years old. So what are the other things? Aside from age, what are the other risk factors for us to lose bones? Number one, female gender. Sige, why do you think kasali ang babae dyan? I mean, bakit pag babae mas mabilis masira yung bones? Ano ba? Bakit yung naging risk factor kung babae ka na magkakaroon ka ng osteoporosis or other conditions sa bones natin? Why do you think? Nga naman na. Sige, let us wait for the others para recorded yung ating participation. Okay, that is correct. Dito mag-start sa pinakataas. Kasi nanganganak. Yeah, that is one of the reason. Females class, syempre, get pregnant, and when ang babae ay pregnant, whatever is nasa body niya, syempre hati sila ng baby. So like yung calcium ng body ng babae, mahahati pa yun sa baby, yung iba doon ibibigay niya pa, okay? Sa anak niya. Okay, that's one reason. Remember, we need calcium for our bone mineralization or for the ossification process. And then, yeah, during pregnancy, parehas kinang answer, nanganganak. And then, yeah, hormones are also included here. Okay? Why we women are more prone to problems in the bone. So take note of this. Low estrogen levels in women will have faster bone resorption. Mas mabilis yung destruction of bones kapag mababa na yung estrogen level natin. So kasali si hormones dyan. Especially if that female is nagme-menopause na. Kasi pag nagme-menopause, ayun na, mababa na yung ating hormones sa body niyan. Okay? And yes, tama din yan. Mas maliit yung bones natin compared sa mga lalaki. So since small in size, ang meaning din yan, yung bone density maliit din. Okay? Maliit din. Hormones. Yeah, ito na-mention ko na kanina, after menopause, ang babae, bababa na yung estrogen level in the body and mas mabilis yung bone resorption kapag mababa na yung estrogen. Mas mabilis yung pagka-destroy ng bone. So kasali yan sa reason. Hormonal changes, hormones, yeah. Pag nagme-menopause, and yes, na-mention ko na to kanina during pregnancy. Nag-decrease. Sige, parehas ba tanan ng risk? Pag mag-menopause, magbaba ang hormone sa body. Okay. Okay, sige. Tama yan lahat. Now, how about the race? Caucasian or the Asian race? Paano naman naka-affect sa bones natin? Yung paggawa or pagkasira ng bones natin, yung race. Kagaya sa atin, Asian tayo. Ano mangyari sa atin kung Asian tayo? Ano yung kanyang magiging result niyan sa bones natin? And sila, kung Caucasian sila, mga puti. Ano kaya? What's the difference when it comes to the bones? Kung ano yung race mo? What do you think? Sa mga din mag-klase sa school, dagan kayong manok ito, klase ko. Sa diet more on rice. Yeah, actually, it's literally because of our small body frames compared to Caucasians class. They are very big. Like Americans are very big. So therefore, automatically they have very big bones. And therefore, hindi basta-basta din yun nababali. No? Grabe ang density sa bones nila. So literally, our frame Kasi yan na nakikita na sa kasunod na factor. Thin and small body frame. Now, sa Asian, maliit na nga tayo. May mga Asians pa talaga na maliit talaga. Okay? So, mga payat din ha. Mga gamay jud og body frame. Syempre, they also have small bones. Now, take note of this family history of osteoporosis. If you have someone in the family na merong osteoporosis, most likely this is passed on to generations. Okay? Meaning yan, it's in your genes class na pagdating ng panahon, you will really have faster bone resorption. Okay? Yeah, included yung diet and lifestyle. Malaki kasi sila, so malakas silang kumain. So that will really add into the yung bone density nila. Okay, and then cigarette smoking and alcoholism. These two are notorious of really causing a lot of diseases. We have mentioned this one in our discussions sa cardiovascular disorders. They are risk factors. Now in the bones, they are still risk factors because the smoking, nicotine in the cigarette and then alcohol can impede or can obstruct the process of mineralization and yung pag-synthesize natin ng new bones. Okay, so since notorious na yan of causing a lot of diseases, I hope let's make it a choice na let's get away from cigarette smoking and also alcoholism. Okay, now lack of exercise. Lack of exercise, Junita na igo ang tanan ani. Wala talaga exercise, so we are not really hindi natin mas-strengthen yung strength pa talaga ng bones natin. Low calcium and vitamin D diet, partner yan silang dalawa, 'di ba? So kapag kulang ka ng calcium in the body or kulang ka ng vitamin D sa kinakain mo, ayan, asali yan siya sa risk factors. Kasi paano mo naman magagamit yung calcium? I mean, kasi we need calcium sa bone mineralization. So anong gagamitin natin kung wala ka nun? Kung low levels yung calcium mo. And even yung vitamin D, remember partner yan silang dalawa. Ito nasabi ko na kanina, low estrogen levels sa mga babae, pero sa mga lalaki class, meron pa rin namang effect. Mas malaki lang talaga yung effect sa babae kaysa sa lalaki. Kasi ang lalaki hindi naman nagme-menopause, hindi nagme-menstruation, hindi nabubuntis. But if they have low testosterone, that will also affect the process, okay, of bone resorption and ossification. Okay, and then we have chemotherapy drugs that can induce early menopause sa mga babae. That's the effect of the chemotherapy agents. And since there is early menopausal, then that would affect the hormones sa mga babae. And then we have amenorrhea. Wala jud menstruation. Kana atong problem din ha. So there is a problem with hormones with that. Okay? Now this is for osteoporosis, but we have other types of disorders sa bones class. Iba din yung tinatawag na Paget disease. I don't know how to really pronounce that one, but yeah, I call this Paget disease. This is class a problem in bone remodeling, and then pag nagkaroon ng problema yung bone remodeling process natin, ang result niyan will be disorganized bone formation, pwedeng masyadong malaki or merong mga deformation. Okay? So this is usually limited to one or a few bones. So abnormal, in short, abnormal yung pag-develop ng bones natin. Di ba sabi ko kanina, continually, nasisira yung bones natin tapos nagsisynthesize tayo ng bago para mapalitan yung nasira hanggang mag-mature yung ating bones. Pero ang problema kapag nagkamali yung ating body no in remodeling our bones, nagkamali yung bone resorption and osteogenesis na process, ayun na. Yung iba mag-e-enlarge, yung iba maliit, yung iba may mga deformities. And aside from the deformities, the patient or the person may also experience pain, okay? Bone pain and mga fractures. So ito yung example class ng Paget's disease na ang involved is yung bone sa paa. Okay? So again, this is limited limited lang sa few bones. So ito yung problem class na hindi na naayos yung pag-form ng bones nila. Okay? The process in the remodeling, may mga kulang ito sila. Pwedeng may kulang silang calcium, may kulang silang vitamins, kaya hindi na siya totally na-form. Na hindi na siya instant na straight, dapat ang bones class parang liliko kasi magsusoften yung bones nito. So liliko siya, hindi na siya maaayos, and this is painful for the person. So daw, iba pod ang bakang ug sakang. Sige, hindi ito bakang or sakang ha, itong Paget disease. This is really a disorder involving the remodeling and then magkakaroon ng enlargement or yung pag-shape ng yung shape mismo ng bones yung maaapektuhan. Dito yan siya. Ano yung butang sa chat box ng mga bakang, sakang, dito yan siya mahuhulog sa osteomalacia. Okay? Sa osteomalacia, there is softening of the bones. Pero what is the reason? This is attributed to vitamin D deficiency. Okay? Again, remember, kailangan natin yung vitamin D para sa bone mineralization, para magamit natin si calcium. Okay? Dito kasi sa asan na yan, Paget's disease, sa remodeling siya mismo, marami siyang factors involved. Pwedeng merong hormones involved, pwedeng yung mga risk factors sa osteoporosis pwedeng kasali dito sa Paget's disease. Ang sa osteomalacia kasi ang problem talaga is kulang ka ng vitamin D na kailangan natin for bone mineralization. Later we'll talk about the treatment for our bone disorders. Okay? Tapos, asa na yun? Sa ayan, osteomalacia class, ang tawag natin kapag sa adult. Pero kung sa bata, we call that rickets. So ito yung sa bata mostly. Rickets ang tawag natin. This is the normal bones here. And then, pwedeng yung iba kasi kulang sila ng vitamin B, magva-vargus sila. Yan yung bow-leggedness. Or yung iba naman, yung magiging effect sa bones is mag-valgus sila, and we call that the knock knees. Saan na siya sa Saan na siya sa Bisaya gani? Sa Bisaya ni. Let's see. Bakang. Ang kaning bow-leggedness mo ni ang bakang, no? And then, ang kaning knock knees mo ni ang kimpi, di ba? Oo siya. That is actually a disorder sa bones class kasi kulang ng vitamin D. Mo na siya class ang mga bata. Kasi ginahimo sa mga baby. Basta buntag. Paget's disease na yung pag sa yan. Hindi talaga siya like totally genetic ng pag na-question si sa taas. Asa na to? Genetic na. Yung sa Paget's disease kasi, hindi siya yung like genetics na, or yung pag-anak, ganyan na yung legs nila. Hindi. Pwede siya even at adulthood, yung paglaki mo, magkakaroon ka ng problem ng sa remodeling ng iyong bone. Sabi ko kanina, nasisira siya, tapos papalitan siya ng bago. Na kapag ka doon sa process ng pagkasira, papalitan ng bago, pagkasira naman, and then papalitan na naman ng bago, nagka-problem doon sa process, hindi na natama yung kanyang ginagawa na bone, and then kulang na yung mineralization, kaya siya nag-miss shape, naiiba yung kanyang shape. Okay? Ito kulang ng vitamin D, kaya hindi siya na-absorb yung, like example, yung calcium for bone mineralization, nagsusoften yung bones, kaya instead na mag-straight siya, nagkaka-deform. And then, yun. And so, ang mga bata, minamassage ang feet, tapos pinapainitan. Yeah, kasi ibulad sa adlaw class, kasi that's how we produce and utilize vitamin D. We need sunlight. Okay? At ang problema karon kay init na kaayo. Yeah, may pag-asa pa ang bones na mag-straighten kapag rickets sa bata. Yung iba like hinihilot kasi 'di ba soft pa kasi yung bones nila. So like kung hilutin mo siya ng tama na paghilot, pwede pa siya. Pero yung iba talaga class na grabe yung rickets, may nakikita ako mga bata na ilalagyan ng brace yung paa. May mga braces tayo for this to correct class yung paa nila. Okay? Kasi again, soft pa naman, so pwede pa siyang maagapan. Okay? Kanang may mga polio. Polio is caused by a virus, no? So, because of that, pag mapunta kasi siya sa bata, remember their bones are still developing. The virus itself will be the one who will impede with the bone remodeling. Okay? So, kaya hindi na lumalaki yung kanilang bones. Hindi sila sa osteoporosis. Okay? So what are the causes of osteomalacia? Again, we have vitamin D deficiency, and then we have certain surgeries like removing or yung mga babies class na may problem sa intestine. Tapos may example, nire-remove yung part ng intestine o kaya nagbabypass sa intestine mismo kasi nga may problema. Nahihirapan kasi sila sa absorption yan. So like yung vitamin D nila and then yung calcium nila in their body or galing sa food nila, hindi nila basta-bastang na-absorb. So hindi din nila nagagamit. Okay? So kaya kasali yung certain na surgeries dyan sa causes sa sa rickets sa bata. Kung sa malalaki, osteomalacia. Okay? And then celiac disease. Si celiac disease naman or celiac screw, ito yung may mga gluten na parang allergic sila sa gluten. Hindi tinatanggap ng body nila. So yung gluten na yan, ano yan siya? Protein yan siya na nakikita sa like sa mga barleys natin, parang mga grains at yung gluten natin. So kapag kumakain sila ng food na mayroong gluten, nagre-react yung kanilang immune system, tapos ang tina-target is yung intestine. And that will be the same thing. Hindi din na basta-bastang na-absorb yung mga kailangan nila na nutrients in their body, isa na dun yung calcium na kailangan for bone mineralization. And then kidney or liver disorders may also contribute to having osteomalacia or rickets sa mga bata. And then drugs also can do that, can impede class bone mineralization. Pwede din silang mag-inhibit class sa process or mag-cause ng destruction sa process of bone mineralization. Pwedeng sa may process doon sa pagbuo ng bone talaga para yung madideposit yung calcium, i-inhibit nun yung mga certain drugs. Kaya kasali dyan. Example, yung mga drugs for phenytoin and phenobarbital, especially if ang bata class kay merong example seizure or merong convulsion tapos binibigyan nito, nagkakaroon class ng problem in the development of their bones kasi hindi na nila example ma-absorb yung vitamin D. And then hindi na mag-deposit yung calcium doon sa bones mismo. Okay? So yun yung mga disorder sa bones before tayo mag-move on sa treatment. Balikan natin. Saan tayo mag-start? We have the first one, si osteoporosis. Ha? Ang problema sa osteoporosis, bakit lumiliko yan siya dito? Before ako mag-move on sa treatment, tanong ko pala bakit nga ito? Bakit mostly yung vertebral column yung affected? Bakit hindi yung bone sa kamay? Bakit hindi yung bone sa paa? Bakit kaya yung vertebral column talaga yung affected na mabako sila class after some time? Anyone who knows bakit yan talaga? Yung kalobat akong laptop ni Dulong lang. Ito kasi yan class, ang di ba babae mostly ang nag-osteoporosis. Tapos example, kulang na sila ng calcium sa body. Maghahanap kasi yung body ng source sa calcium. Bakit makukulangan ng calcium? Number 1, hormones. Number 2, pregnancy. Pag nakulangan na ng hormones, ay ng calcium class, syempre hahanap yung body ng source ng calcium. Tapos, for example, hindi siya kaya ng diet. Yung kinakain mo, hindi kayang mag-provide ng kailangan mo na calcium sa body. So, ang ginagawa kasi ng body class, sisirain. Sisirain yung bones. Kasi remember, may calcium na nasa bones natin. Sisirain ng body natin yung calcium na nasa bones para kunin yun and ibalik sa blood. Kasi nga, kailangan mo ng calcium. Marami kasing function ang calcium sa body, hindi lang sa bones. Remember, calcium is found in the blood. Example for blood clotting. Okay? And then, remember, calcium is also used for the action potential sa ating heart para mag-beat siya. If you can still remember our lesson sa arrhythmia, kasali si calcium doon. Kung papasok si calcium, merong certain effects sa body. That is also true for our brain. Okay? And if you go back to the synthesis of both acetylcholine and norepinephrine, diba? Remember, you need calcium. Diba? Kailangan may calcium influx para ma-release natin yung both norepinephrine and acetylcholine. So maraming trabaho si calcium in the body. Now, tayong mga babae, talagang dadating ang time na makukulangan tayo ng calcium. Okay? Nasabi ko na ang reasons bakit. So again, hahanap yung body natin ng source para may gagamitin tayo for muscular contraction, for our heart, for our brain, and for all the other things. So sisirain yung bones para i-release yung calcium na nakadeposit dyan and then ibalik siya sa blood. Okay? Now since yung pinakamalaki natin na bones is the vertebral column, so yan yung parating target. Yan talaga yung unang sisirain ng body natin kasi dyan may pinakamaraming calcium. Okay? So yan yung problem natin with osteoporosis. Kaya mga babae, as we age, we really need to have enough intake of calcium. I'm not saying na mag-overdose tayo ng calcium para delete na mag-osteoporosis. Enough lang na intake. We can get that one from our diet, or yung mga babae talaga na nag-i-age na pwede silang mag-take ng calcium supplement. Kaya 'di ba? Marami tayo yan sa market. You're having your community internship ngayon. You can observe there ano yung mga calcium preparation natin sa market na present. Your internet connection is unstable na po na mag-choppy na pagkuhan eh. Calcium name. Generic name yan, calcium culture. Calcium, I don't know the brand kasi yan ba? Pero Anong klaseng calcium nga yan? Yung nasa calciaid and calciumate? Kasi both are brands. Calcium carbonate. Okay, please remember that, calcium carbonate. Okay, do you have questions before tayo mag-move on? Wala? Wala, sure na. Possible ang structuring bone. Possible na ang structure ng bone ay parehas sa may osteo, pero wala kang osteoporosis. Actually, kapag ka hindi talaga nag-mineralize, I mean, hindi na-deposit yung calcium sa bones mo, parehas atong sa osteoporosis, nagbuslot-buslot, osteoporosis, gito siya. So, mao na imuhang bone structure jud atong problema ana dali fragile magugkay na kay walay unod ang ilahang bones, gamay na like injury ma-fall, like matumba lang sila, mabali na din ilahang bukog. So ang uban okay lang kung nabali, di na sila mamatay, pero yung iba talaga labi na mga babae tapos nag-osteoporosis na niya, ma-fall good sila, mahulog sila, for example matumba sila tapos nagkaroon sila ng fracture labi na sa ilang hip, usahay mo na ilahang ginakamatyan. Pero kung like structure tas wala kang osteoporosis, meron ka talagang osteoporosis, meron ka talagang disorder kapag ganun yung structure ng iyong bones. Hindi complete yung iyong bone mineralization. Pag nag-start na ka osteoporosis, maagapan mo pa yan. Mag-straighten ko to sa itong nilingkuran dire. Pag nag-start kag osteoporosis, pwede pa siyang maagapan. And that is like, number 1, give calcium supplements para hindi good di mangita imuhang body o other sources. Kay mo magyud na iyang himuon, pag kulang na gyud kag calcium, gubaon man gyud na niya imuhang bones kay para ma-release tong mga calcium dinha. So pwede ka mag-take og calcium supplement para dili na niya gubaon imuhang vertebral column kay nana kay supply of calcium. Pwede mo mag-take anak class. Dili na pasobraha ka ng what is needed lang. So yes, pwede pa siya maagapan para dili jud ka mauwi sa kanang mag-ani na gyud ka imuhang structure. Dili pwede isabay si calcium and si iron. Wait lang. Let us be sure with the answer. Hi. Not sure. I think so. I heard about that. Wait lang ha. Did I ask you to download the Medscape? Nagsabi ba ako sa inyo na mag-download ng Medscape? Wala ko nag-ingon sa inyo ha? Medscape. Wala. Wala di ay. I-search mo ninyo ng app sa Medscape class. Medscape. Ay, how do I share this one? Siya sa akong phone. This one. This one, the Medscape. And then if you can see sa screen, madako ba ninyo ang screen, ane? Na-interaction checker din ha. This one. Pindutan na siya. Ay, kigwa. Mali ako ng pindot. The interaction checker. Pwede niyo itong gamitin if you're not really sure, no? Kay, syempre, daghan kay tag-drugs, dili gid na ito na ma-memorize sa kadaghan. Kabalot akong para asa sila, like sa ako, ang case, I know asa sila ginagamit na disease, pero when it comes to interaction, syempre, dili na ito ma-memorize na natin nabalaan ka ng mga common nga interactions, pero pag dili na ganin na common, dili na ito sure ana. So what I do is, like, I always consult this one. I-click niyo yung interaction checker dyan. And then, lagay niyo yung drug na gusto niyong sabayin. And then, mag-ano yan siya, magpa-prompt kung meron siyang interaction or wala. Kagaya nito, hindi ko siya na-delete kasi chinek ko ito last time. Makitaan? Tell me ha kung di makitaan. Na-check ko kasi ito last time. May nag-ask kasi sa akin, pwede bang isabay si aspirin and si glimepiride. And then sa baba niyan, may nakalagay 2 interactions found. And then, let's view the interaction. I-explain niya kung ano yung klaseng interaction ang meron and ano yung gagawin mo. So, ang sakit ng pangutan ni isa. Dahil lang. Saan na to? Backreads ako kaya yan. Huwag sa ilalim. Calcium. Wait lang, let's clear this. Para sure ta sa atong answer. Hindi ta magpataga. Ferrous. Let's just write ferrous sulfate. 1 interaction found. Ferrous sulfate increases levels of calcium carbonate by enhancing gastrointestinal absorption. Applies only to oral form of both agents. The interaction is minor, but nevertheless, it is still an interaction. So, we will not be giving them concomitantly. Wag na lang natin silang isbay. Kasi again, the ferrous sulfate increases the levels of calcium in the body. So kung gusto mo mag-calcium and then mag-iron, wag mo siyang isabay. Pero kasi kung sa buntis na ang binibigay talaga natin folic acid kasi folic acid is very important in cell division. Diba nag-start na tayo ng anti-cancer drug? Kasali kasi doon sa process class ng pag-synthesize ng ating cell si folic acid. So since the baby inside is still developing yung cells nila, kailangan doon si folic acid. Hindi yun siya para lang sa mama, para din yun siya sa baby. Unsa ning advisable every day? Asa na unsa na ganini? Yeah, if magsobra okay, ara na day sa ilalom ang dugtong. Yeah. Mo na siya na in moderation when it comes to the calcium supplement kasi it will form kidney stones pag nasobrahan. So you have to evaluate first your diet if you can get enough calcium on the foods na kinakain nyo. Yun yung pwede na kayong hindi talaga mag-calcium supplement. Pero if you think you cannot get enough calcium in your diet, then you may have the supplement class. But take note, supplements, vitamins, and other supplements are not really taken whole year round. Like as in adlaw-adlaw for the whole 365 days. Hindi kasi ganyan yung pag-take niyan. You can have at least a month of taking that, at least a month or pwede din 2 months, but you have to make sure na you will give your body a time to rest. Okay? So for example, after 2 months, you will stop taking the supplement, and then magre-return ka after 2 months also, or after a month. So mag-cleansing muna yung body nyo to prevent accumulation. Okay? That is also true, for example, not just with the calcium supplement, the vitamin C supplement, and vitamin C na ininom natin as ascorbic acid, that is not to be taken whole year round, na as in 365 days adlaw-adlaw. Okay? Hindi yan siya araw-araw tinitake. I mean, the whole 365 days or a whole year. Dati pa first year. I hope you still have your Medscapes kasi marami talagang questions when it comes to interaction, if pwede ba nating isabay yung itong drug na ito sa another drug. So since we cannot download, we cannot store everything in our brain, especially the interactions. Kaya I need the help of the app to check that. Especially if ang pinapacheck na sa iyo na interaction is like polypharmacy na okay lang sana kung dalawang drugs. Pero paano yung person na nagpo-polypharmacy? Example, hypertensive and at the same time diabetic siya. So marami siya expected na marami na talaga siyang drug, no? Check niyo na doon kung meron ba talaga silang interactions. Oh, tama na siya. Mervin, kapag may problem ka with the bone mineralization, example, kulang ka ng calcium sa body mismo ha, not just sa bone, sa body mismo kulang ng calcium, maghahanap yung body natin ng source. Kung hindi mo siya talaga nabibigay sa diet mo or yung sa ininom mo na supplement. So again, maghahanap ng source ng calcium yung body natin. And yung mahahanap talaga niya na source is yung sa bones. Kasi nga yung bones natin, class, may mga calcium dyan na naka-deposit. So, ang ginagawa, sisirain class ng body natin, yung bones na yan, yung bone na yan, para ma-release yung calcium. Yung calcium na nare-release, dinabalik yan siya in the blood. And if nasa blood na siya, we can use that one for other functions. Okay? Yung mga functions na nasabi ko kanina, including the release of the neurotransmitters and the contraction of our muscles. Okay, ganito ha. Kasi sabay talaga yan siya piniprescribe ng doktor. Pero as pharmacist, you can actually counsel the patient of the time kung kailan nila iinumin yung mga drugs na yan or yung mga supplements na yan. Now, since there is a minor interaction, pwedeng i-advise nyo sila na hindi nila i-take yun ng sabay. They may have at least 2 hours interval. Okay? 2 hours interval. Yun yung sasabihin nyo sa patient ninyo. At least 2 hours of interval. Just to avoid the interaction. Pero kasi pag major na yung interactions natin, class, most likely, yun yung mga hindi talaga natin pwedeng isabay kasi manganganib yung patient natin sa adverse effects or sa toxicity. Exercise for osteoporosis. Wait, I think we have non-drug treatment later for that. Pwede naman. Kung hindi nila alam, that's the time you tell them to have the interval ha, at least 2 hours. Even other drugs, not just with this one, yung mga nagpo-polypharmacy, you check anong drug yung pwedeng isabay and ano yung hindi pwedeng isabay kasi may possible na interaction. That's what I did with my father. Katong buhi pa siya. Kasi syempre polypharmacy yung may heart failure siya. Before he died, he was diagnosed with diabetes mellitus. So marami talaga yung drugs. Ang ginawa ko noon, I really checked one by one yung mga interactions. Ano yung mga drugs na may mga interactions, ano yung wala. So kapag nakita ko walang interaction yung dalawang drugs na ito, sinasabay ko na siya. Kasi naghimo jud ko atong schedule niya, gipilit jud to nako sa among kusina, napatoy copy nga gipilit nako sa tapad sa iyang higdaan para he's constantly reminded na this time ito yung iinumin niya. Yun yung ginawa ko. Naglagay ako ng schedule. Example, 8 o'clock. Okay, ganito yung iti-take niya. And then, after 2 hours, kadaghan man kayo siya tambal. So, ito naman yung pwede niyang i-take. May mga sinabay ako doon, pero I really checked first whether they really have interactions or wala. Okay, that's what we can do to help our patient achieve maximum activity or maximum effect of the drug, but at the same time, ensuring that they are safe. Actually, the Medscape is a very big help for me. Okay. Anything else? Wala. So let's move on to the treatment. Oh, I still have time here. I still have time. Treatment of osteoporosis. Before we move on to the drugs, let's have first the non-drug strategies. Okay? So the first one, adequate dietary intake of calcium and vitamin D. Take note ha, dietary intake. So that is the reason why when we were in elementary, we were really taught the different types of food, go, grow, and glow, and that we are really taught that we really need to balance our diet. Ha? Balance dapat. Hindi ko sinasabing kailangan sobra-sobra kasi remember, the difference between a drug and the dose, the drug and the poison is the dose. Okay? And then weight-bearing exercise also can help to make our bones strong. So yes, may mga possible na exercise na pwedeng gawin para sa kanila. Okay? But we have to consult the experts for that. Example, yung mga physical therapist natin on what exercise pwede sa kanila. And then, syempre, sabi ko kanina, smoking, nicotine plus can contribute to bone resorption, okay? Or can obstruct bone remodeling process. So please avoid as much as possible smoking, and at the same time, even alcohol. Let's just add alcohol here. And then, take note, there are drugs that can increase bone loss. Sabi ko kanina, at the age of 35, most of us will lose 0.3 to 0.5% ng bones natin. Mas mabilis na yung bone resorption kaysa sa osteogenesis. Mas mabilis na yung pagkasira kaysa sa pagkabuo ng bagong bones. So kung magdadagdag ka pa ng drugs that can actually increase the process of bone resorption or yung bone loss, ayun na, mas mabilis pa yung magiging progress ng osteoporosis. So what are these drugs that can increase the speed of bone loss? We have glucocorticoids, our corticosteroids. Yung mga asthmatic people are actually taking this, no? Especially class if the corticosteroids are taken orally. Yung sa inhalational, since most likely the drug will just be in the nasopharyngeal papunta sa bronchioles, pag hindi siya na-absorb, medyo okay lang. Yung problema natin yung orally taken drug. Talaga. Kasali talaga yan siya dyan. Board exam question, kasali yung osteoporosis sa adverse activity of our corticosteroids. Okay, aside from diabetes mellitus. And then, aluminum antacids class can increase bone loss. The aluminum itself can impede the bone mineralization for our calcium, our anticonvulsants, furosemide, yung ating loop diuretics, aromatase inhibitors, will have the separate discussion for that. And then we have heparin, the PPIs, the proton pump inhibitors, the SSRIs. Are you done with the antidepressants sa PICOL 1? Let me know if are you done with the antidepressants, like the SSRIs. Okay. So you already know what are the SSRIs? Ano yung reason why nag-take ng corticosteroid aside sa asthma? Aside sa asthma, ano pa yung indication ng corticosteroids? Ganun yung ina-ask mo? Tama akong pagkasabot? Again, aside sa asthma, unsa pa ang indication? Aside sa asthma class, syempre the corticosteroids are actually inflammatory drugs, anti-inflammatory drugs. So we use them for inflammatory conditions. Number 1, yung allergies are actually included there. Kasi 'di ba, yung histamine, kapag ka nag-take na yan siya ng action, inflammation yung hulog niyan. Okay? So, yung mga rashes dyan, inflammation pa rin naman yun. Okay? So, that's number 1, allergy. Tapos, yung mga other pa na inflammatory conditions, especially if the inflammatory condition is chronic, just like our arthritis. Okay? Rheumatoid arthritis. Gumagamit din tayo niyan ng corticosteroids. What else? Corticosteroids are also considered as immunosuppressants. Okay, they have the ability to suppress the action of our immune cells. Therefore, immunosuppressant sila. Kapag example, may transplantation na gagawin, syempre for the body not to reject the transplanted organ, you can give immunosuppressants. So it may be corticosteroids. Ha? Adlaw-adlaw ga take og prednisone for what? For what? Prednisone, I mean the corticosteroids should not be used long term. Kay daghan kaayo na siya systemic nga adverse effect. Isa na din na ang osteoporosis. Thus aside from that, it can cause hyperglycemia also, mauwi yan siya sa diabetes mellitus. Daghan jud kaayo ang adverse effects sa mga corticosteroids nato. And then the dose should be according to your body weight. Gamay kay ka, tas ang imuhang inumon 50 milligrams nga jud. Okay, so kanang mga small ang body frame din ha, and then dili man lang severe ang imuhang case, dito jud ka sa gamay nga dose, class 5 or 10 milligrams, okay na yun siya. Wala ginaingon, mag-dispense na po. That is the reason why we classify our drugs as OTC or prescription drugs. So supposedly, ano ba nakita niyo sa lalagyan ng corticosteroids natin? Di ba merong RX? So supposedly that is a prescription drug. That should be prescribed by the doctor. Some of them are actually using the corticosteroids as pampatambok. One toxicity or adverse effect of corticosteroids is yung fluid retention in the body. They can cause edema. So most of them actually mistook the edema as like natambok sila. So feeling nila vitamins, pampatambok. And in fact, nag-edema lang sila kung inyuhang i-check ilahang body class, daghan og tubig sa sulod. Okay? You have to be a positive contributor to the community. You really have to educate the people in the community na what they are doing is not really good and that they are harming their body's class. You educate them. Even the PAs there, mga pharmacy assistants, kasi the reality here in the Philippines, yung nasa frontline is not the pharmacist anymore. Yung mga PA ang nasa frontline, pangitaan ninyo asa ang pharmacist nasa likod, nagkahera. O dyan akong problema nga nung nasa sila sa likod. The pharmacist kasi dapat yung nasa harap. Kasi yun yung dapat makikipag-talk sa mga patients. Drenex. Saan ang Drenex? Mo na akong problema basta tagahan ko ninyo. Brand name kay wala ko kaila. Dexamethasone. Unsa daw? Ginagamit asa luas. Ha? Why? Luas class is caused by pwede siyang bacterial infection, and that is class an indication that you have low immune system. Kapag ka nagaluas ka, nagalow imuhang immune system, kaya ka nagkakaroon ng mga sugat-sugat dyan sa loob. Hindi na nakaya ng immune system mo yung mga bacteria and mga fungi na nandyan. Diba? One causative agent of the oral thrush is the Candida albicans. That's the fungus that is not just normally found in the vagina. The Candida is also found in the mouth. And if you have low immune system, the candida can attack that part of your body. And that's the time it will cause oral thrush. So indication yan siya na you have low immune system, yung oral thrush na yan. Except na lang ha kung naka-braces ka din ha, masigig kasabit imuhang braces sa imuhang baba. Manang daghan ka pirmig luas. Pero kung wala man lang, indication yan siya na mababa yung immune system mo. And remember, corticosteroids can be classified as an immunosuppressant. So why do you suppress your immune system? Na suppress naman siya. You really have to educate that those persons na gumagamit niyan. Uy, class, di ba? Sabi ko sa inyo, when I discussed anti-asthma agents, yung mga corticosteroids natin na inhalational, pag nagpa-puff sila, di ba you have to educate your patients na after nila mag-puff, they have to gargle. They have to gargle. After gargling, syempre they have to spit that. No, hindi nila yan isa-swallow. The reason why they have to gargle is para maalis dyan sa bibig nila yung corticosteroid na in-inhale nila. Kasi kung nandyan siya magsistay, yung part na yan will be immunocompromised. So kapag nandyan yon, immunocompromised na, pirmi na sila magkaluas kung dili nila to tanggalon ang mga nabilin niya, corticosteroid. Tapos kung nailuas sila ng tambal, na-appeal naman sa tambalan, dexamethasone. As in? Why? Patingala sa tao. In what dosage form na Drenex? Kinsa may nagsugod ana? Ako kung problema. Maka-frustrate ang community. Now you know. Ngita jud ko asa ko makakita ang pwede na siya sa please educate them. Do not hesitate to do that. Ha? Ay, wait lang.